The top stories tonight in Y News. The Department of Health declared that the Omicron variant of the COVID-19 is now the predominant variant in the National Capital Region, also driving surge in regions and provinces.
The Department of Transportation clarifies that those unvaccinated who will be heading to work or those medically incapable of being vaccinated are exempted from its no vax, no ride policy.
The Philippine government hopes to fully inoculate all adults against COVID-19 before the national polls takes place in May.
President Rodrigo Duterte has approved the recommendation of the Department of Education to expand the limited face-to-face classes in areas under alert levels 1 and 2.
Good evening, Philippines and the world. We are now reporting live from Quezon City, and today is Tuesday, January 18, 2022. Join us in the next hour as we deliver today's top stories around the Philippines and in other parts of the world. I am William Theo.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website untvweb.com. I'm Angelo Castro III.
First in the news, an increase in new coronavirus cases has been observed in all regions and provinces in the Philippines. Meanwhile, the Omicron COVID-19 variant has become predominant in the National Capital Region, or NCR. Nel Maribuhok will tell us why.
The Department of Health reported that new COVID-19 cases in all provinces and regions in the country is rising. During the House briefing on the COVID-19 situation in the country, Dr. Aletea de Guzman, Director of the Epidemiology Bureau of the Department of Health, disclosed that the increase alone in the National Capital Region and nearby provinces, or the NCR Plus, is larger than the peak that was observed in September 2021 brought by the Delta variant.
We have now observed an increase in cases across all regions and all provinces, highly urbanized cities, and independent component cities. But there are still areas whose counts are lower than what we are seeing now in the NCR Plus. But we're already seeing continuous and swift increases.
However, according to de Guzman, the current surge shows fewer severe and critical cases, which means less hospitalization. The official noted that the increase in COVID-19 cases were driven by the highly transmissible Omicron variant.
These case increases that we've seen, especially in the National Capital Region, is driven by Omicron, but is also facilitated by our increased mobility, our reduced compliance to minimum public health standards, as well as delays in our detection and isolation.
De Guzman added that the Omicron variant has become predominant in the National Capital Region.
Our latest whole genome sequencing showed that the Omicron variant is now the predominant variant in the National Capital Region. It's also detected in 13 of 17 regions, and in the National Capital Region, 15 of its 17 areas already have local Omicron cases.
DOH Secretary Francisco Duque III during the talk to the people last night that the Omicron variant already composes 90% of the latest genome sequencing. And the Philippines is still under critical risk for COVID-19 even as the growth rate of infections has slowed down. Nel Maribuhok, UNTV News and Rescue, we serve the people, we give glory to God.
The Philippines recorded 28,471 new cases of the novel coronavirus disease, or COVID-19, pushing the nationwide case count to 3,270,758. Active COVID-19 cases stood at 284,458, or 8.7% of the total number of cases. Of this, 270,784 are mild, 8,930 are asymptomatic, 2,957 are moderate, 1,484 are severe, while 303 are in critical condition. The DOH also reported 34,892 new recoveries, bringing the total to 2,933,033. while 34 died, bringing the death toll to 52,962. Meanwhile, the overall global COVID-19 caseload has topped 330,849,781, while the deaths have surged to 5,546,164, according to the Johns Hopkins University. The U.S. is the worst hit country, with the world's highest number of cases and deaths at 66,421,749 and 851,730 respectively. This is followed by India and Brazil.
Meanwhile, the Department of the Interior and Local Government, or DILG, said that there is no such thing as COVID-19 vaccination exemption cards. DILG spokesperson Undersecretary Jonathan Malaya said in a statement they have received reports that this card supposedly originated from Facebook groups and group chats in Davao Region and Socsargen that can allegedly be registered to local government units or LGUs. The cards are also supposedly recognized by local authorities in lieu of COVID-19 vaccination cards. Malaya said the government will never issue nor recognize such cards because this runs counter to the government's national vaccination program to inoculate the majority of the populace to achieve population protection. He also called on local authorities to be more vigilant in their inspection of vaccination cards at provincial and regional borders amid restrictions being implemented for unvaccinated people.
The Department of Transportation received complaints against the implementation of the no vaccination, no ride policy in public conveyances. But the agency clarifies the rule is not absolute and has exemptions. Asher Kadapan Jr. explains why.
Workers or employees not yet fully vaccinated against COVID-19 were reported to have been prohibited from utilizing public transportation amid the implementation of no vaccination, no ride policy. But the Department of Transportation explains that the passengers were lacking proof of their employment or other pertinent document exempting them from the rule. In a statement, DOTr spokesperson Assistant Secretary Goddess Hope Libiran clarifies that the policy is not absolute and has exemptions. The exemptions include those who have been prohibited to get fully vaccinated due to medical condition, where they are only required to present a medical certificate, while those needing to travel due to medical checkup, examination, work, procurement of essential goods, application of license, passport, and others, they just need to present proof of their activity, including ID for employees, confirmation of appointment, barangay health pass, among others. Labor and Employment Secretary Silvestre Bello III says a company ID should be sufficient in letting unvaccinated passengers ride any public conveyances.
No vax, no ride policy. Exempted po ang mga workers natin because they are rendering essential services. Pag tingin mo mga yan, paano gagalaw ang ating mga negosyo? Pag walang negosyo, walang ekonomiya. So luckily, exempted po ang ating mga workers.
For informal sectors, the DOTr says barangay pass may be secured as a proof of their essential travel. The Civil Aviation Authority of the Philippines, however, confirms that partially vaccinated air passengers may be allowed by airlines to travel if they are returning home from another place. CAAP also reiterated that fully vaccinated passengers should have completed their vaccination at least 2 weeks prior to their travel date.
At kung sila po ay returning resident papunta ng NCR, pabalik sa kanilang mga resident sa Metro Manila o pabalik naman po sa kanilang mga probinsya, at kung sila ay nanggaling sa Metro Manila, kung sila po ay partially vaccinated, kasama po sila sa mga exemption, kaya sila po ay papayagan. Pero in general po, ang implementasyon po natin, kung hindi po kayo vaccinated, ang definition po ng IATF ang ginamit natin, 2 weeks after po ng second dose ng 2-dose series at 2 weeks after po ng 1-dose series gaya po ng Janssen.
The DOTr further emphasized that the enforcement of no vax, no ride will only be in effect while COVID-19 Alert Level 3 or higher is hoisted in the National Capital Region. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
The Philippine National Police, or PNP, will not arrest commuters who have yet to receive their COVID-19 vaccination shot. Meanwhile, cops will also be deployed as mystery passengers in public utility vehicles. Leia Ilagan reports why.
The Philippine National Police confirms that police units are still assisting transport authorities in implementing the no vaccine, no ride policy in public transportation. But PNP spokesperson Police Colonel Roderick Augustus Alba said they will still defer making arrest on violators. Instead, they will just advise them to go home.
Naging matagumpay po ang unang araw ng implementasyon sa no vax, no ride policy ng PNP, DOTr at LTFRB sa Calakhang, Maynila. Hindi natin pinapahintulutan sumakay sa mga pampublikong sasakyan ang mawalang maipresentang katibayan na sila ay bakunado.
Alba also said those unvaccinated but with proper documents will be allowed to board PUVs.
Ang mga hindi nabakunang pasahero na nanamit naman ang criteria for exception to the policy ay pinapayagang sumakay at bumiyahe.
The PNP also plans to deploy personnel that will serve as mystery passengers in public utility vehicles to monitor if health protocols are properly observed. The mystery passenger will get a plate number and other details of the PUB if driver violates the health protocol. This will determine the appropriate sanction to be imposed. The PNP also warns those using fake vaccination cards that they can be imprisoned for up to 6 months and fined up to 50,000 pesos. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
The labor advisory is encouraging private sectors to provide paid leave for their isolated or quarantined workers. Will be challenging to small businesses according to the employers group. JP Nunez will tell us why.
Small businesses have not yet fully recovered from their loss due to the ongoing pandemic. Employers Confederation of the Philippines or ECOP explains micro, small and medium enterprises or MSMEs are still struggling to stay afloat and abiding with the labor advisory will be difficult.
Kalahati ng mga micro yun nagsarado na. At yung iba hindi malaman kung tutuloy o hindi dahil hirap na hirap. Pasweldo lang, nahihirapan. Halimbawa, 20 yung daming nadali, 20 yung empleyado mo. Yung 5 nagkasakit, hindi kaya ng mga micro yan.
DOLE encourage employers to provide paid leave to their employees in need to undergo home or facility-based quarantine or isolation due to contraction of COVID-19. However, the employers group said they still fully support the rationale of the said labor advisory. The group expects their members who are owners of large companies to provide the paid leave for employees undergoing isolation or quarantine. Work-from-home setup are also recommended so workers may continue to get compensation even when working remotely. ECOP Chairman Sergio Ortiz Luis said that even last year, they also implemented a similar setup.
As early as last year, in-encourage namin yung mga miyembro namin sa ECOP at sa PCCI na kung pwede, maganda samahan ng labor at sa employers kayo kung pwede, kung kaya rin lang nila, bayaran na lang nila yung mga isolation at mga quarantine na yan. At marami naman sumusunod.
Secretary Bello DOTr explains that the labor advisory is not mandatory. Only those businesses or companies capable of giving paid leave to their workers are expected to provide the additional incentives.
Ito kasi ay nakita namin doon sa nangyari sa isang big company. Ito yung Banco de Oro. Out of generosity and compassion, the President Desicoson of BDO extended yung leave credits ng mga workers nila by 10 days. Because of this, nag-issue kami ng advisory urging yung mga employers in the private sector na kung kaya nila ay mag-extend din ng leave credit sa mga workers nila.
Secretary Bello explains that even if employees have their leave credits, the advisory was released to give additional assistance to workers when they are forced to undergo quarantine or isolation.
Ito naman is benefit kung pagkasakali lang ibigay ng employer this is in addition doon sa mga benefits nila that they can obtain either from SSS or from ECC.
The sickness benefit program of the Social Security system may cover up to 4 days of quarantine and isolation of qualified members. They will receive benefit allowance even if they leave from work due to accident, illness, or quarantine and isolation. JP Nunez, UNTV, News and Rescue. We serve the people. We give glory to God.
President Rodrigo Duterte has approved the recommendation of the Department of Education to expand the limited face-to-face classes in areas with lesser alert level restrictions. Eileen Cerudo will tell us why.
The Education Department assures they are in close coordination with the Department of Health and local government units in making sure physical classes will still be safe. DepEd eyes on opening the expansion of limited face-to-face classes in February.
Yun ang aming proposal, Mr. President. February ang pag-expand, pero maingat pa rin, taking into consideration the advice of the Department of Health, the LGUs, as well as now the Department of Justice.
However, DepEd says this will only apply to low-risk areas or areas under Alert Level 1 and 2. During President Rodrigo Duterte's talk to the people last night, DepEd Secretary Leonor Briones said only vaccinated teachers and non-teaching personnel will be allowed to participate in physical classes. It will also be safer for students participating in the face-to-face classes next month if they are also vaccinated against COVID-19. Secretary Briones assures the department will still consider the recommendation of the DOH and concerned local government unit.
Ngayon, yung framework ng shared responsibility, patuloy, yung pag-concur ng LGUs, alam namin ito, conscious kami, at saka parents' consent, requirement pa rin, Mr. President. Hindi kami mag-i-expand ng basta-basta, na hindi kami mangangatok sa local governments at saka hindi namin makuha yung written consent ng mga parents.
DepEd reports the pilot implementation of the face-to-face classes was successful. It is also prepared to make the necessary adjustments amid the threat of the Omicron variant. According to acting presidential spokesperson Carlo Nograles, President Duterte supports the expansion of face-to-face classes.
So with no objection, kumbaga walang objection si Pangulo doon, and after the presentation ni Sec. Briones, then tuloy-tuloy po nila yung pag-aaral nila. Again, it will be the DepEd and the DOH combined who will be assessing the expansion ng pilot implementation ng face-to-face classes under DepEd.
Meanwhile, the Commission on Higher Education announces universities and colleges in Metro Manila will push through with the face-to-face classes next month.
Lahat po ng malalaking state universities at colleges sa Metro Manila ay magbubukas sa February. Ang UP po ay February 7 magbubukas, imbes na January, dahil tinitignan pa nila kung ano ang kalagayan on the ground.
CHED also reminds institutions to make sure teachers, students, and staff are safe from the COVID-19 threat before opening physical classes. Based on the report of CHED, 63% or 4.1 million students are vaccinated, while 96% of teachers and non-teaching personnel are fully vaccinated. Meanwhile, several universities in Regions 8, 7, and Caraga are still closed due to the onslaught of Typhoon Odette. Eileen Cerudo, UNTV News and Rescue. We serve the people. We give glory to God.
The national government aims to fully vaccinate the adult population before the 2022 elections. Meanwhile, COVID-19 booster doses will be available in select pharmacies and Metro Manila beginning Thursday. Rosa Nicos reports.
4 months are left before the May 2022 elections, and the Duterte administration is intensifying the vaccination campaign against COVID-19. Acting Presidential Spokesperson and Cabinet Secretary Carlo Nograles revealed the government aims to fully vaccinate all adult population by the end of March in preparation for the national elections.
ang next target po natin is to reach the 77 million mark by end of first quarter of 2022, which is by end of March of 2022. Kasi gusto po natin na by end of first quarter, ang total adult population po natin, which incidentally are the voters, kasi adult population, di ba? So sila po yung mga botante natin. Bago pa man sumapit ang April or even May, gusto natin na yung adult population natin ay lahat po ay fully vaccinated.
Meanwhile, the government is expanding the vaccination sites for booster shots through the cooperation of pharmacies and private clinics. The pilot implementation will be held on January 20 to 21.
We will now start with 7 pharmacies in Metro Manila, which we will launch on Thursday, January 20, and on Friday, January 21. And mabilis po ito, Mr. President, pagka-launch po natin at magpapilot sila ng mga 1 linggo, mag-i-expand na po tayo ng mabilis sa iba't iba pang mga cities all over the country, Luzon, Visayas, and Mindanao, at sa iba't ibang mga butika.
Selected branch of 7 pharmacies and private clinics in the National Capital Region will participate in the pilot implementation, particularly Mercury Drug, Watson's, the Generics Pharmacy, Generica, South Star Drug, Qualimed, and Healthway. Malacanang reminds the public only those who are eligible for boosters and have registered in their corresponding local government units will be able to avail of the free booster dose. The local government units will still be in charge with registration and documentation, while the pharmacies and clinics will manage the actual administration of the booster dose. To ensure social distancing, walk-in is not allowed.
Kailangan po tayo magparehistro. So that way, we can make sure na yung pupunta lamang sa butika para magpaturo are those that need booster shots.
100 booster shots are allotted for each pharmacy every day, and a total of 3,500 doses for the pilot implementation in 1 week time. Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
The newly renovated Manila Zoo is set to become a mass vaccination site for minors and senior citizens. Meanwhile, Vice President Leni Robredo is not concerned about her low ratings in the recent survey of presidential aspirants. Nel Mariboc will tell us why.
Manila Mayor Isko Moreno today announced the opening of new Manila Zoo tomorrow. The zoo will serve as a vaccination site for children and the elderly and will only serve 1,000 people daily.
An elderly can go to Manila Zoo starting 8 a.m. to 8 p.m. Minors 12 to 17 years old, first dose. Minors 12 to 17 years old, second dose. And elderly, whether they're guardians, parents, or yung mga lolo't lola ko.
Free tickets can be availed at manilazoo.ph and book appointments for vaccination at manilacovid19vaccine.ph. Meanwhile, Vice President Leni Robredo is present during the meet and greet with her supporters. Robredo said she is unfazed by her low ranking in poll surveys.
Marami pong nag-aalala na sobrang baba pa natin sa surveys. Although number 2 na tayo, nagsimula po tayo para number 6 yata ako sa surveys. Number 2 na tayo ngayon pero marami pa tayong ihabol. Hindi po tayo dapat mabahala.
Robredo said she wants to help the micro, small, and medium enterprises through the conditional stimulus package to allow them to pay their employees. She also wants to give small businesses access to capital through low-interest loan. Meanwhile, Senator Manny Pacquiao vows to prioritize the welfare of healthcare workers. During the consultative meeting with the health sector, he said if he wins, he will push the 50,000 peso minimum pay for healthcare workers.
Sakaling ako ay mananalo, titiyakin ko po na maitaas ang sahod ng mga nurses at healthcare professionals sa minimum na 50,000 kada buwan.
In a news release, Ferdinand Bongbong Marcos believes that the use of renewable energy is one of the most effective ways in solving the problem of high power costs in the country. Marcos said aside from bringing down electricity rates, it will help in saving country's environment and natural resources. He said the country will use natural sources of energy and will eliminate the use of coal and fossil fuel. In his FB post, Senator Panfilo Lacson warns anew the corrupt government officials.
Magkawala na kayo. Hindi kayo nararapat mapabilang sa ating lipunan.
In another statement, Lacson vowed to fight corruption as it robs the people of a chance at a better life. He has maintained a strong anti-corruption advocacy from his days as the chief of the Philippine National Police to his stint as senator. Meanwhile, Labor leader Leo de Guzman expressed support for the bill seeking to institutionalize the University of the Philippines Department of National Defense Accord, which bars any military and police presence inside its campuses without prior notice. De Guzman said institutionalizing the academic freedom is needed not only to UP campuses but also to other public and private universities. Nel Maribuhok, UNTV News and Rescue, we serve the people, we give glory to God.
The Commission on Elections, or COMELEC, assures the ballots for the 2022 May elections will be printed on time despite the rising COVID-19 cases in the Philippines. Dante Amento tells us why.
The poll body has adopted several strategies and contingencies for the ballots printing to be completed on time. COMELEC Printing Committee Vice Chairperson Helen Aguila Flores says printing of ballots will begin tomorrow, January 19, at the National Printing Office or NPO. Ballots for the overseas voting will be printed first since they will vote ahead of the May 9, 2022 polls. Over 1.6 million ballots will be printed for overseas voting. Meanwhile, ballots to be printed for the local voting will be over 65.7 million. The poll body has allocated 1.3 billion pesos for this process. The COMELEC adds the last set of ballots for the National Capital Region will be printed from April 12 to 21, 2022.
For the ballot production group, working in 2 shifts, day shift and night shift, I think we have 150 workers. For the ballot verification group, we have 700 workers working in 2 shifts. And for the ballot quarantine group, I think we have 100 job order casuals also working in 2 shifts. But for now, until the end of the month, we have adopted a batching system in view of the surge.
The Commission also assures to print all the ballots on time despite the current COVID-19 restrictions or constraints.
This is a very modest timeline that already includes a buffer for contingencies. And yes, for the apprehension that this pandemic situation will really hamper our timeline, actually we are foreseeing that. There is a contingency plan to come up with a reserve pool of workers. We have also adopted strategies such as batching of workers.
The COMELEC disclosed they can print 1.1 million ballots a day using 3 printing machines with 1 reserve in case of any problem. The Armed Forces of the Philippines, Philippine National Police, and the Bureau of Fire Protection are in support for providing security. A walkthrough was conducted this morning to show the process of the ballots printing with strict observance of the health protocols.
Ginagawa natin ang walkthrough na ito para mapakita sa ating lahat kung gaano kaigpit ang ating mga protocols para masiguro na tama at secure ang mga balota at iba pang forms na gagamitin natin sa halalan. Mahaba at mabusisi ang prosesong ginagawa ng ating printing committee dito sa NPO.
Printed ballots will be transported to the different COMELEC offices across the country. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
The Department of Health, or DOH, is preparing guidelines for the distribution of home care Kalinga kits for the vulnerable population who have mild COVID-19 cases. Janice Inhente gives us the details live. Yes, Janice, good evening. How many home care kits will be distributed?
Yes, William, good evening. Over 35,000 Kalinga kits will soon be distributed to the vulnerable families and individuals with mild COVID-19 and are undergoing isolation in their homes. This aims to provide COVID-19 patients home care package during their home isolation. The Kalinga kit contains 20 pieces of face mask, vitamins and medicines such as paracetamol and carbocysteine, disinfectant spray, soap, alcohol gel, and an information sheet.
Ang criteria natin sa pagbibigay, ibibigay po dun sa ating mga vulnerable population na nag-isolate or nagka-quarantine. At pangalawa, tayo po ay continuously na i-upgrade natin yung Kalinga kits na yan as more of our donors and private sector partners will come in and collaborate with us.
DOH Undersecretary Maria Rosario Vergeres said they are currently drafting guidelines for the distribution of the kits.
Itong DOH Kalinga kits, currently we are just drafting the advisory and the guidelines for our implementing units kung paano natin ipinapatupad. But definitely, as soon as possible, magdi-distribute na po tayo.
The DOH developed the kits through a partnership with the World Health Organization and the private sector led by Unilab and PNG. William Vergeres said the agency will continue to upgrade the kits as more donors and partners come in. Back to you, William.
Yes, thank you, Janice and Hente reporting live from Quezon City.
The Department of Transportation signs a single largest rail contract with China contractors for the Philippine National Railways or PNR Bicol project. The 142 billion peso contract aims to construct the first 380 kilometers of PNR Bicol from Calamba City to Daraga Albay. It involves the construction of 23 train stations, 230 bridges, 10 passenger tunnels, and a 70-hectare depot across 39 cities and municipalities under 4 provinces and 2 regions. Along with its future segment in Sorsogon and Batangas, PNR Bicol will cut travel time between Metro Manila and Bicol from the current 12 hours by road to as short as 4 hours. During construction, the project is expected to generate more than 5,000 direct jobs per year.
For the news abroad, as numerous countries roll out extra booster shots to at-risk groups, a preliminary research by an Israeli hospital raises concern that the fourth COVID-19 vaccine dose may provide limited defense against the Omicron variant. Maria Latosa will give us the details live. Good evening, Marielle.
Good evening, Elsie. The said study found that a fourth shot of the COVID-19 vaccine was able to boost antibodies to slightly higher levels than the third shot. However, this was not enough to prevent Omicron variant infections, according to Israel's Sheba Medical Center. Professor Gili Regev-Yoche, the director of Sheba Medical Center's infectious disease and lead researcher, reported that there were still a lot of infections of the Omicron variant among those who received a fourth shot, though the number was slightly lower than among those who had not gotten the extra dose. Since last December, the clinical trial administered a fourth vaccine to more than 270 medical workers who had previously been vaccinated 3 times with the Pfizer-BioNTech vaccine. 154 received a Pfizer-BioNTech booster and 120 others received Moderna's. The participants were compared to a control group that did not have the fourth shot. Specific data on the fourth shot's effectiveness against hospitalization or death against Omicron has not been released, Elsie. Dr. Nachman Ash, director of Israel's health ministry, said the research did not mean the fourth vaccine effort was a mistake, and it can be taken into account as authorities debate whether to expand the additional booster campaign to the broader population. Elsie?
Maria, how many people have now received the second booster in Israel and who are eligible?
Elsie, the Israeli government says over 500,000 people have received the second booster in recent weeks. For now, only immunocompromised residents, senior citizens, and healthcare workers are so far eligible for the fourth vaccine shot. Back to you, Elsie.
Thank you, Maria Latoza, reporting live from Australia. As more people roll up their sleeves for their COVID-19 booster shots, reports of one side effect in particular are on the rise. The most common adverse side effects from the third COVID-19 vaccine dose appears to be swollen lymph nodes. The Australian government's Therapeutic Goods Administration, or TGA, has been monitoring the side effects of the booster vaccine as it has made its way through the population. The TGA closely monitors reports of suspected side effects to the COVID-19 vaccines, and it has received approximately 600 reports of suspected adverse events identified as a third or booster dose. TGA also notes that it is a normal and known side effect of vaccines and occurs when the immune system is stimulated. The Association of Southeast Asian Nations, or ASEAN, delays its first meeting of the year set this week. Mavian Dog will tell us why live. Yes, Maeve?
Elsie, the year's first meeting of the Association of Southeast Asian Nations under Cambodia's chairmanship was pushed back due to difficulties of the ministers in attending the said event. Without further elaboration, according to Cambodia Foreign Ministry spokesperson Khoi Kuong, this is due to travel difficulties. Moreover, this postponement is also amidst the unresolved disagreement over Myanmar's invitation to ASEAN, following last year's remarkable step of sidelining the junta chief from ASEAN's annual summit of leaders. This is due to his failure to honor the commitments towards ending violence. According to Abdul Qadir Jailani, Indonesia's foreign ministry official, time is required to resolve the issue with Myanmar. However, Cambodia's delay on this week's meeting is understandable since Omicron variant remains a risk. Meanwhile, Cambodia Prime Minister Hun Sen met Myanmar's military ruler Min Aung Hlaing last week. The country expressed its intention to engage the junta and had invited its foreign minister to the ASEAN opening meet. This part concerned that it could damage the international efforts to isolate the junta and was opposed by the Malaysian foreign minister and Singapore's prime minister. Elsie?
Thank you, Mavian Dog, for that live report. The World's Anti-Doping Agency has released a warning for the 2022 Winter Olympics athletes heading to Beijing to avoid eating meat products while in China. Charisse Longbowen will tell us why live. Charisse, please go ahead.
Good evening, Elsie. The World Anti-Doping Agency, or WADA, reported that meat products in China have been known to contain a synthetic steroid called clenbuterol. With the upcoming 2022 Winter Olympics, athletes are warned to exercise extreme caution, as ingesting contaminated meat products injected with a steroid will produce positive results in performance-enhancing drug tests. WADA's statement closely follows the previous warning of the German National Anti-Doping Agency, urging athletes to avoid Chinese meat and find alternatives instead. Clenbuterol is a banned steroid both in the US and in Europe. It is said that the drug stimulates the cardiac and central nervous systems and are illegal to be tested in animals. However, ingesting the steroid in meat products is still widely practiced in various countries. WADA added that athletes can source their meals safely from approved food chains or restaurants within the athletes' village. The athletes will be inside a closed-loop transport system within the village, so finding food to eat should not be a big issue. Furthermore, the Games will only welcome athletes and closely selected spectators due to the first COVID-19 Omicron variant case being identified in Beijing. The committee emphasized a zero-tolerance strategy against COVID-19 for the athletes as well. All athletes and personnel will be closely monitored and tested daily, as outlined in their official pandemic prevention brochures. Elsie?
So, Cherise, what will be the impact if an athlete tests positive on a performance-enhancing drug test or doping test?
Elsie, a positive drug test commonly results in an athlete's lifetime ban from athletic sporting events. However, the WADA did clarify that athletes who test positive with low levels of the steroid clenbuterol is often a result of eating contaminated meat, which may have different consequences from an actual drug doping. Elsie?
Thank you, Cherise Longbowen, reporting live from Bangkok, Thailand. And those are the reasons behind the news in other parts of the globe. I am Elsie Marcos, live from Auckland, New Zealand. Good evening.
A Ghanaian woman who has an ailing sister wishes to be able to support her more, but cannot do so without a source of living. She needs help to be able to open up her business again. And her wish has come true with God's help and mercy. Nina Armilio has the story.
About 8 months, getting to them 1 year. Na nikun be we see and you say
45-year-old Mary Gilsawa worries about her older sister Mary, who has just lost her husband. Mary wants to help her widowed sister, but she herself has her own problems. She lends a helping hand with her husband's earnings, which can only do so much. She has other siblings who also do their part in caring for Mercy, who now lives with one of their younger sisters. With this predicament, Mary wishes to open up a small business once again, to be able to do more for their ailing sister. To ease Mary's worries, members Church of God International brightened up her day and brought plasticware to sell, plus MCGI free store items. Grateful and joyful are we that we are able to witness God's wonderful works. His goodness abounds for people who have learned to call upon His name faithfully. For whatever language, color, or race, MCGI will be a small instrument in spreading God's loving grace. Because MCGI cares.
And before we close, we will leave you with a word giving glory to God from the book of Proverbs, chapter 17, verse 22. It says, "A merry heart doeth good like a medicine, but a broken spirit drieth the bones."
And those are the reasons behind the news, January 18, 2022. Recently delivered to you as they unfold. Namang Ilocos for the 3rd.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.